So how can I share the screen from my presentation?
So ma'am, at the bottom of the screen, you can see the option of present now.
Okay.
Okay. So this is when, if you have your PowerPoint already open, so you can just click on present now, and you will have to select your entire thing, a window or a Chrome tab. You will have to select the second option, which is a window.
Okay.
And then you can see the option of the PowerPoint.
Okay. Thank you. Yeah.
Hello, ma'am. Hi, Uda. Hello, Krishnaveni, ma'am.
Hello.
Hi, I'm Pradya.
Hello.
Hi, Janvi.
Hello, ma'am. Good afternoon.
Manjot is there?
I think not.
Yes, ma'am. Yes,
Hi,
ma'am, I'm
Manjot.
there.
On the slide.
Shilpa? Shilpa is not there, I think. Ma'am, till the girls are joining. Hello.
Hello.
Ma'am, we have our team. I'll just introduce you to them.
Okay.
We have Dr. Janvi from Human Development Department, Assistant Professor.
Hello.
Hello.
Hello, Dr.
We
Janvi.
have Ms. Manjot from BCA Department, Manjot Kaur.
Hello.
We have Mrs. Shilpa. Shilpa has joined? No, no, I think so. Shilpa from Nutrition and Dietetics Department. And we have Ms. Huda Sayed as our project assistant.
Hello.
Myself, Dr. Pradnya. And we have Mala ma'am, Professor Mala Pandurang, our principal. I think she will
Hello,
join
ma'am.
between
Yeah.
maybe. She has not joined. Mala ma'am is not there.
Okay.
She may join in between.
Okay, that's fine.
I think Harsha will also join us. Harsha is there. Hi, Harsha.
Hi, Harsha.
Harsha
Hello,
is also
ma'am.
there.
Hello.
From faculty members.
So hopefully the internet won't let us down today.
Yeah, ma'am. Ma'am, last session we had on review of literature by Dr. Neha Lohia.
Okay.
Last session. And
Review of literature. Okay.
Review of literature, yes.
So you're not going in any particular order, or do you have specific?
Yeah, we started from basic
Okay.
overview of research, then in search of research, like qualities required for a researcher, characteristics.
Okay.
And then we had formulating research problem, objectives and all that by Dr. Janvi. Then we had by Dr. Neha this review of literature, and now we are having your session.
Okay. Yeah, good. I mean,
and then,
ethics can be presented at any time. That shouldn't be a problem at all.
So. And Dr. Kumaran sir has also accepted the invitation, so he will be addressing students next week.
Okay, that's
on
good.
making of
Yeah.
research proposal.
Oh, it's a good topic.
Yes. We will start in 1 minute, ma'am.
Okay, yeah.
2:29, no? Um,
So I'll
Girls
just,
are joining with I can see little less numbers today of
that's
students.
fine. I
Yeah,
mean,
but they may
research
be
is not a
joining, right?
popular topic anyway. So how many students do you expect usually for this?
100 at least, 100, 120.
Oh, that's a
They
big
are
number.
joining, they are joining slowly.
Yeah.
Sometimes they have classes also in the
Mm.
morning session.
So is it I mean, is it something that you have started recently and it's part of their curriculum?
Yes, yes, ma'am. Yes, ma'am. No,
Okay.
not a part of a curriculum.
Yeah.
These are the special sessions under Stride project that we are actually
Okay.
implementing right now. That is
Good. Yeah.
the funding that we have received from
Okay.
UGC,
It's
basically
a
for
good
research
initiative.
capacity building, yes, of
Mm.
undergraduates. Of course, we are
It's
having
very
for
good.
PG also. We have
Okay.
Miss Sonu Mishra from
Mm.
PG section. She
Okay.
will be having session with I mean, today we have a session for a master students also. So she is
Okay.
handling that.
Okay.
So I think Sonu is not there, na, today here. I think she's
No, I think she will join
Yeah,
the
she will
master's.
join. She is looking into PG section. So we
Okay.
have, ma'am, simultaneously on Monday, we have sessions for undergraduates and for PG students
Okay.
with different resource persons.
Okay.
Uh, so,
That's
so this
good.
is a part of that. These are the sessions we are having under Stride basically for
Okay.
research capacity building of students.
Okay.
And we are planning to have a selection of students from the
Mm.
entire group that we have, all the third year students,
Yeah.
BSc as well as BCA.
Okay.
And then we will be having some criteria for selection of these students. And then we will
Okay.
take them forward with more sessions on research capacity building. And we are trying to offer them a structured syllabus,
Okay.
course, so that they can earn some credits
Mm.
by just
Good.
doing that course. So that we are
That's
planning.
good. Yeah. Really glad to hear that. It's a very, really great initiative.
Yeah, thank you. Yeah, thank you, ma'am.
Okay. Yeah, sure. Are we ready to start?
Yes,
Yes,
we
ma'am,
will
we
start.
begin now.
And Huda will introduce you for the session. Good afternoon, students. Huda,
Yes,
you
ma'am.
take over.
So good afternoon, everybody. Welcome to our sixth session on promoting research ethics in higher education. Today we welcome our speaker, Dr. G.V. Krishnadeni, uh, who is going to speak to us about the topic ethics in research. So, ma'am holds a degree in epidemiology. So, talking about,
Hello.
are you all able to hear me clearly?
You're breaking actually.
Huda, you can be a little louder.
What about now?
Yeah, that's better.
Right now? All right. So,
Yeah.
ma'am is an epidemiological researcher working for over 20 years in studies on the developmental origins of health and diseases in Mysore. She started her research career by helping to set up the Mysore Parthian cohort at the CSI Holsworth Memorial Hospital in Mysore. Her special interest all along has been to investigate the long-term associations of maternal gestational diabetes on offspring cardiometabolic and psychological risk. Over the years, she has developed networks with eminent researchers for collaborative research and pedigree data analysis and is part of a consortium of Indian birth cohort study groups. At the moment, Ma'am is a senior scientist at the Epidemiological Research Unit at the CSI Holsworth Memorial Hospital. Her achievements involve her association with the Wellcome Trust, the PBT India Alliance Senior Fellowship and also the Immediate Research Fellowship. Ma'am has also been able to contribute through her publications in about 50 peer-reviewed journals as well. So, ma'am, we welcome you today for our session on ethics in research. We hope to have an enriching session with you.
Thank you. Thank you very much for the introduction, and thanks for inviting me to present this session to the students. I'm really glad to be part of this initiative. And apart from what Dr. Smita told about in my, can you all see my presentation?
Not yet, ma'am.
No, ma'am, not yet.
It's saying it's showing it is sharing the presentation. Anyway, so I'll try again. It's not happening now also.
It is, ma'am. It is fine.
Ma'am, it is presenting. The screen is coming.
Okay.
Ma'am, it is gone again.
Yeah, it's coming.
It's coming now. Yeah, it's coming.
Anyway, while it is on, is it there now? I can't see.
Yeah, it's visible now.
It's visible to you all?
Yes, ma'am. Yes, ma'am.
For some reason, I can't see it. I don't know if that is the...
Ma'am, your screen is visible. We can see the slide.
Yeah, ma'am.
So I just have to go to my screen and start presenting. That's how
yes, ma'am.
it is,
Yes,
ma'am.
Just make it into slideshow, ma'am. Slideshow.
Okay.
It is in a sorter mode right now.
Okay. Can you see the first slide?
Yes, ma'am. Yes.
Okay, so what I want to say is that, I usually do interactive sessions, so it's not possible now. So I have given my email ID here. If anybody wants to ask about their queries and questions, they're welcome to contact me on this email ID. So, thanks for that nice the introduction. And I also would like to add to that to say that I also sit on the ethics review committee of 2 institutes in Mysore, and I also part of data monetary safety committees of 2 international trials. So you can imagine that ethics is one of my favorite topics in research. So I will be mostly talking about ethics in biomedical research, which is my background. So just coming to the basics, what do you mean by ethics? What are ethics? See, we are all human beings and we live in a society under certain customs and certain guidelines. Ethics is derived originally from a Greek word called ethos, which means character, a moral set of principles, a custom that we all have to inculcate in our daily life when we are dealing with other human beings or other living beings. So we can't just go and hit somebody next to us or behave rudely to our neighbors. So we all live in certain based on certain moral principles, certain good conduct, we can say. So when we are doing research, the same set of principles apply as to how we should conduct the research in a safe, in a respectful, and in a very acceptable environment, which is all about ethics in research. So as I mentioned here, when we particularly deal with human research, ethics pertains to the set of principles where we promote and ensure respect for all the participants who are part of your research, so that you will protect their health, their rights, and their dignity as they participate in your research. So not only protect their health and dignity, but also you maintain the integrity of the research so that whatever you present and whatever you find will be, of utmost, honest and transparent representation of what you have conducted as part of the research. And you also give right to the participants how they want to participate, when they want to participate, and when they want to leave the research. You respect their privacy and confidentiality, and you don't divulge their personal information to anybody other than those who are part of the research team. So one of the most important aspects of ethics in research that the responsibility of maintaining the research ethics always lies with the researchers and not with the research participants. So you, as a researcher, you always have to keep in mind that you will have the total responsibility of maintaining all these aspects I told you about the research in ethics, and the research participants are not held accountable for any aspect of ethics in research. So let us get to some a bit of history of ethics in research. See, in olden days, probably in 17th or 18th century, even in 19th century, ethics in research hasn't been heard of. If you think about olden days, where all this, so even in Vedic periods or even in Middle Ages, see, nobody even thought about ethics in research. They conducted all sorts of rigorous research among their students or their patients, or sometimes even on themselves. So in the modern times, in civilized times, one of the most horrific aspects of conducting research without any heed to the ethics happened during the Second World War, mainly by scientists in Japan and Germany, who conducted all this abominable, horrific research among prisoners of war. So they had no concern for their health or safety or their comfort, and they conducted voluntary, deliberate research. As you can see, it's a Japan scientist conducting a cruel experiment on one of the prisoners of war in the name of medical research. So even more horrific researches were conducted by the German scientists when the Nazis were ruling in those parts during the Second World War. And the Nazi human experiments were one of the most shameful blot on human history, where they conducted all this extreme degree of cruelty on prisoners of wars in concentration camps, where they exposed them to freezing temperatures, low air pressures, radiations, electricity. They introduced very contagious diseases in the name of helping medical knowledge. And even in children, they conducted surgeries even without giving anesthesia as part of their research. So when the Allied forces defeated Germans finally at the end of the Second World War, they brought all these soldiers as well as the scientists for a trial for them to answer for this cruelty in the name of research at a place called Nuremberg in Germany in 1947, and they were convicted of their crimes. At the same time, a group of scientists and well-meaning scientists developed a code of conduct for researchers in future, which is famously known as the Nuremberg Code of Ethics, and this is one of the first international ethical documents that is known to the modern society. So the Nuremberg Code, the main objective of the Nuremberg Code was to protect human subjects from cruelty and exploitation from those who are in power. And one of the most significant aspects of this is promoting voluntary consent for taking part in the research. they maintain that this is the most essential aspect of conducting research. So after Nuremberg Code, it was the declaration of the Helsinki, which is by World Medical Association, which actually consolidated all ethics related aspects in research. So it was proposed in 1964, and since then it has undergone several revisions. And it is one of the most commonly referred ethical guidelines in the world. Researchers anywhere in the world talk about Declaration of Helsinki. Helsinki is a place in Finland where it was first proposed, and every nation which has its own set of ethical codes for research draws aspects and knowledge from Declaration of Helsinki. This has several basic principles, like proficiency, skills, and minding the risks, confidentiality, etc. Again, one of the most significant principle to remember is the necessity for taking a written informed consent before a participant is assessed for any research. So I'll talk about informed consent later. So now we'll come to India. In India, it's the Indian Council of Medical Research, which actually governs and supervises all the medical research, whether it's conducted on humans or animals. And it has its own set of ethics, again drawn mainly from the Helsinki Declaration. The first ICMR ethical guidelines document was released in 1980, and it has again revised several times over, and even as late as 2017. So this has a very comprehensive guideline and guide to the researchers as to their responsibilities when they start a research to maintain the highest ethical code of conduct. So especially on human participants, the Indian Council of Medical Research mandates that any medical research that involves human participants should enhance knowledge about human conditions. You can't just do any research randomly for the sake of a paper or just to get some grants. You should show to the ethics committee that the research that you are conducting actually increases the knowledge about human health and human conditions over and above whatever is already existing. The second point is that you can't just use human beings for research just as guinea pigs. It is not just something you force your research on. So you have to make sure that your research will be conducive to their dignity and respect as well as their health, and you have to treat them with utmost respect and fairness, and your research should be as transparent as possible. And your research should be monitored at all stages. You can't just start the research and until you continue, don't submit report. So that is not acceptable. Every aspect of your research should be monitored and supervised at all stages. So these are the three mandates of ICMR ethical guidelines. So I'll talk in detail about ICMR ethical guidelines because that is what is most applicable to the research in India. So ICMR guidelines has 4 basic principles: respect for persons or autonomy, where the persons will have the right to choose their willingness to participate in the research. And it should be made clear to the persons that, if they don't take part in your research, it wouldn't be acted against them. That means if a doctor is conducting the research, he can't force the patients to take part in the research. So he can't say, if you don't take part in the research, I won't treat you next time. Or, don't go to the other doctor, go to the other hospital. So that will be the most abominable way of conducting the research. Even a doctor, even if he is in the power, the patient has to take part in the research voluntarily. The patient as a research participant, should have the full autonomy to decide whether they want to take part in the research or not. The second basic principle involving ethics in biomedical research is the beneficience. The beneficience aspect is that the research should directly or indirectly benefit the person who is taking part in the research as well as to the society at large. And there is also the aspect of non-maleficence. So which means the research that you are conducting shouldn't cause any harm to the participant or to the general population or to the society at large. And finally, the justice, the research should maintain a fair treatment of all parties concerned and should have a fair selection procedure for the research. These four general basic principles are further divided into 12 general principles which form the foundation for the ethical guidelines in India. I'll just give a brief account of those guidelines. The first guideline is what is called as the Principle of Medical and Health Research. So as it says, it is the general principle to maintain the right, safety, and health of the research participant. And the researcher should acknowledge that it is the participants' overall safety and well-being, as well as maintaining their right and respect, is the most important consideration in a research, even if it harms your data collection, even if it harms your final findings. So the first consideration should be the well-being of the participant. So as I said, the second principle is the principle of essentiality. Unless the researcher is, utterly convinced that this research is most essential to improve the human conditions over and above whatever knowledge already exists, that research shouldn't be considered at all. See, as a member of ethics committee, I have several times questioned the validity of a research if they are just repeating what somebody else has already done in the next state or next country. Unless it brings something more to the population in question, that research is not considered essential, and you are unnecessarily actually putting so much discomfort on the participant. So it is not an ethical way of conducting research if you don't consider that as essential. And principle of voluntariness, as I said earlier, they should have the right to participate, they should voluntarily agree to participate, and they should be given the right to withdraw from research at any stage of your research. They can not only withdraw from the research at any stage, they can even request you to delete all their previous data. I mean, you can set a time, like, you will have the right to withdraw your data, up to 2 months from your initial consent. So till then, they have the right to withdraw their, ask you to delete their data which has already been collected. But they can refuse participation, future participation at any time during the research. So even if it runs for 5 years, and they can withdraw just at a crucial moment and you can't say anything. You have to respect their right. And you also should make sure that just because they withdrew from the research, you shouldn't harm them in any other way, like, their right to get treatment from a hospital, or, if you are powerful, you can't just, make them suffer in some way. So principle of voluntariness should be respected. And as I said, they shouldn't be exploited because they are in a vulnerable position. So in some cases, the groups themselves will be vulnerable. I'll talk about it later. And it's very easy to coerce them or, convince them to take part in the research. That shouldn't happen. You should ensure the privacy and confidentiality of all the personal information that you collect of the participants. And you should take care that there is minimal risk involved in the research. If the participant takes part in the study, you should make sure that they're not hurt unduly. They should be as low discomfort as possible. So the seventh principle is the professional competence. So it mandates that a person conducting research should have the competency and skill to conduct that particular piece of research. So you should demonstrate to the ethical committee that you are proficient in the research that you are proposing. And there should be an accountability for all the things that you do as a part of research. Every single action assessment should be documented and presented to the public if needed. And there should be a benefit to the participant directly or indirectly. Either it improves their health directly, or it improves their behavior, which might improve their health, or if not to them, to the general society. You can tell the participants it may not have any benefit to you, but the knowledge gained from this research will actually help this population in this area, because you are similar to the population in this area. Knowledge from you might help thousands of people. You believe it or not, when you put it that way, people are really sympathetic, and they want to take part, even if it is not for them. They want to take part for the general population. We have several instances where we have openly told them that it doesn't help you, but it might help other people like you, and they're more than happy to take part with that knowledge. So the researcher should always be open to the participant and tell them what involves to them in terms of either benefits or risks. And there is the institutional arrangement, where the research takes place. The institute should have appropriate policies to monitor the research, and also to provide facility to the research. And as I said, there should be a transparency where all your reports and all your methodology should be publicly displayed if needed. And finally, as I mentioned earlier, all this, taking care of all these principles, handling all the aspects related to research, the overall responsibility lies with the researcher and not with the participant. So ICMR mandates these 12 principles for anybody doing research. So one of the things that repeatedly occurred in reference to this is the informed consent process. What is informed consent? See, as I said, both in the Nuremberg Code of Ethics as well as in Helsinki Declaration and our own ICMR guidelines, informed consent takes the precedence over all other aspects of research. If the informed consent is not met with, you can't do your research. So what is informed consent? As the name suggests, it is consent. A participant should consent to participate in the study after being sufficiently informed about all the aspects of the research. So the first responsibility of the researcher while recruiting a participant is to give the participant all the information about your research. What is the research about? Why are you conducting it? What is the role of the participant? Whether they get any benefits out of it? If, whether tangible benefits like, some free gift or, some reimbursement of the money, or some intangible gifts like, indirectly to their health or behaviors, it might have an effect. Or it may not, how does it help the society at large? What are the risks involved? And how the researcher and the research institute are equipped to handle if any risk appears. So after giving all this information to the participant, the researcher should give the participant sufficient time to consider this and to ask questions and to clear their doubt. Only after this lengthy information process, they should give consent. Only then the consent is valid. Now, most of the ethical guidelines mandates that the consent should be written. That means the participant should sign the consent form saying that they agree to participate. But for some researchers, like where there are clinical trials, where drug trials, where actually you test the new drugs, if you are involving a human participants, you actually have to videotape the consenting process to show to the authorities that you have provided all the information to the participant. And it is not only giving the relevant information, so you have to give an information sheet also, a written document of what you said. You have to make sure that there was a comprehension involved. That means the participant understood everything. So it should be in the not only in the language that the participant understands, but it should use the words and terminologies that make them help understand the information that you are giving. Mind you, all this information is mostly scientific, so they may not understand the scientific terminologies. So you should make sure that they understand everything properly. So comprehension is very important. You should give them time. And then the participant should voluntarily agree to participate after these two processes. Whenever you give them information, whenever you ask them to take part and provide their consent, so you have to tell them that their participation is voluntary, and if they don't voluntarily participate, it won't affect their rights in terms of their treatment or future participation in research, and there won't be any harmful side effects of not agreeing to participate in the research. And you should also make it clear that they can withdraw from research anytime that they want without any undue pressure or undue harms occurring to them. So what happens if a person is not capable of giving consent? It may be a child, or it may be, legally, a person who is legally not allowed to consent. People who don't have stable mental faculties, there may be legal barring to give them consent to such researchers. So whenever there is a situation where the individual on whom the research has to be conducted cannot give legally binding consent, then a person who is there, in case of children, a parent or guardian, or an adult who can't give consent, a guardian or person who is taking care of them can give their consent. Especially in case of children, if they are between 7 and 18 years of age, the consent can be given by the parents or the guardian if the parents are not present. But we should also take what is called as assent from children. Assent is usually, it's not a legal document, it is not like informed consent, but you should still ask children, see, this is the research we are doing, we'll do these things on you. Do you want to undergo this kind of assessment? And it can be just verbal or it can be written, because written assent doesn't have any legal binding. It can be just verbal. Unless they say, yes, we can't do research, even if the parents say it's okay to go ahead, conduct research on the children. See, it's only between 7 and 18 years. Below 7 years, the ICMR considers that children below 7 years are not capable of even giving assent. So the whole decision will be taken by the parents in this situation. So at all times when you are taking informed consent, the researcher should make sure that there is no inducement or coercion involved. You can't say, see, if you take part in the research, we'll give you so much money. If you take part in this research, we will give you this gift, or we will give you free treatment for a year. So that is inducement. See, after they participate in the research, you can give a token of appreciation or reimburse their time and other expenses involved. But you can't use money or any kind of material or other benefits as a way to lure them into the research. That is called inducement, which is a strict no in terms of ethical conduct of research. ICMR doesn't recognize that as voluntary consent. Similarly, coercion, which is a kind of threat. If you don't take part, next time you come to the hospital, we won't take you, we won't treat you, or it might have an effect on how we might treat you next time. So these things are again not acceptable, which is a threat. So consent given either through inducement or coercion are not valid and not binding. So it is a serious, exception to the code of conducting good research, and ICMR doesn't accept that, and it might have serious repercussions on the research itself. So that should be kept in mind. So in this slide, I have given an example of an information sheet, a participant information sheet that we have used in one of our studies. So it should have all these details. So it should say why we are doing this study, what is the need to do this study, and why should we do in this population itself? Why should we do this on you? So why not in some other place? So you have to give a detailed description of why you are doing this study in the language that they understand. Then you say, if they participate, what are all the assessments that you are going to carry out on them? So is it physical? Is it psychological? Will there be questionnaires? So are we taking bloods? Are we taking any other body fluids? So you give every information, and what do the tests involve? For example, a test where we want them to speak publicly. We want to measure their hormones, then their BP while they are doing a public performance. It's a stress-related task. We can't say we carry out a stress test. We have to say what actually are we doing, and what will be their part in that. So after that, we mention what will be expectation from them. If they agree to take part in the study, they may have to come in the morning, or they may have to come in the evening, or they may come for 2 days, 3 days. They may want to have to stay for the whole day. What actions they need to take, or what assessments or experiments will be doing, so that they will prepare mentally that what it will involve. If they have to come for the whole day, do they have to take a leave, or should they come on Sunday? So they can decide all those things. Okay, should they come fasting? Should they come after lunch? So all these details need to be given. And finally, we have to give them in detail what will be our responsibility. We will tell them that we will provide for their travel, we will provide them lunch or dinner or some kind of refreshment. We will make sure that they will be safe in our institute. And if there are some assessments which involve pain or discomfort, we should mention how much discomfort it may cause. Is it painful? If it is too much, it is too painful, what will we do? So what will we do with the result? Shall we just, share the results with everybody, or do we keep that confidential? So all these things need to be mentioned in the information. So we also mentioned that their blood samples will never be used for commercial purpose. So we are making it clear to them that we are not selling their samples for money. So it's purely for research purpose. And that's a different aspect in itself. If we find something and if it has commercial benefit, then we have to go back to the ethics committee again. We may have to go back to the participants again to say that we might be benefiting from them. And if it is too much of monetary benefit, how we are going to disperse that? Are we going to give a share to the participants? All these things are a different aspect, and I'm not going into detail about this. This is an example of information sheet. This is an example of informed consent form. After the participant read or heard about the details of the research and understood everything properly, they will be asked to sign the informed consent form. So just to read this, again, we will read out, I will ask them to read the consent form in the local language. For example, in Mumbai, it might be Marathi or Hindi. In Karnataka, it will be Kannada. But we'll have English also for some people who don't know the local language. So we will read out and we'll also ask them to read again. So this consent form says, I have been informed that as part of this study, I might be asked to undergo an MRI scan of the brain. I have been explained about the procedure and the involved risks as stated in the information sheet in the words that I can understand, and I am willing to take part. I am aware that I have the right to refuse consent at any time without giving reason. It is very, please keep in mind, this sentence is very important. They should understand that they can refuse consent at any time without giving reasons. Moving on. This will not affect my medical care or future participation. I understand that I have to give extra time for undergoing this assessment, and I give them my consent for this, and I'll undergo this test. So that's how the consent form reads. So if it is a child, it is the parents who say that, my child has to undergo this, and I give consent on behalf of my child. And we take their name and signature. And one of the researcher, an interviewer, has to provide a witness signature. If it is the child, we have to mention what is the relationship of the consentee to the child. And this is the child assent form. We will ask the child, are you happy to undergo this test? This is what it involves. And if the child says yes, then we will write the child's name. We can ask the child to write the name themselves, but it is not binding, so we might as well write. So this is the example of consent form. So we'll talk a bit about what is called as the vulnerable groups. See, vulnerable groups are those individuals who are incapable of protecting their interests or their right, either because of their age or because of their disability or because of the circumstances they are born into, their lack of power. For example, a child, if the parent decides, the child has to undergo tests, the child doesn't have the authority to overrun the parent, so the child is dependent on the parent, it doesn't have its own, children don't have their own autonomy in that sense. So research in children should happen only if it is absolutely necessary to do the research using children to improve the health of the population. Otherwise, research should never be done on children. Similarly, persons with disability, persons with mental issues, people from lower socioeconomic strata, people, you can say to a poor person, if you don't come, I won't sanction you this, I won't provide you this, or I can give you 10,000 if you come. So you can somehow coerce or induce people in lower socioeconomic status. So people in that category are vulnerable. Likewise, people in certain health conditions can also be considered as vulnerable group because some of the assessments may be harmful for them. So some examples are economically and socially disadvantaged groups, children, as I said, women in special situations like pregnancy and lactation. Because in these situations, it is not only, if there is a risk, the risk is not only for the mother, but also for the growing baby or the lactating baby. So you should be considering the risks or harms involved for two participants when you ask one person to take part in the study. So pregnancy and lactation, or lactation means breastfeeding the time of the, after the birth. So these two are considered as vulnerable periods for women. Similarly, terminally ill people who are in the last stages of their life due to severe illnesses will be considered as vulnerable. So research must be planned in vulnerable populations only if that population will benefit from the research. You can't do research in vulnerable groups to benefit some general healthy population. So if you do research in children, it should help children. If you do research in mentally ill, it should help mentally ill population in the world. So that is one of the mandates for doing research in the vulnerable populations. So just a couple of slides on research in animals. See, a human being can think for himself, he or she can consent, refuse consent. Even the vulnerable populations, there will be somebody to take care of them. It's not the case with animals. See, animals can't say no. So any type of research can be done on animals. In these days, there is a lot of hue and cry about animal cruelty in research, rightly so. The easy targets, the word, the term guinea pig itself has come from using guinea pigs rampantly in any types of medical research. See, most common researches where the animals are used in place of humans are, when you test new disease occurrence, new treatment, when you're looking for new diagnosis, or, ways to prevent disease and vaccinations, in this current COVID time, everyone is now heard of how a clinical trial is done, how a vaccination trial is done. So the first stage is always where you test your new vaccine or your new drug on an animal. So only if it succeeds there, then you move on to the humans, because it is, ironically, it's called inhuman to test it on humans in the first instance itself. But it's okay to test on animals. It's ironical that it's okay to test on animals, and a researcher can subject to an animal to all these different horrors like diseases or drugs which might cause side effects. But we don't have any other way. So in some cases, we might look for alternatives. In most of the cases, we don't have any other way. We have to use animals. Most commonly used animals are rats and mice, but we also use monkeys and rabbits for vaccination, etc. Pigs and dogs for surgical trials, and again cows and horses for vaccinations. But though we can't avoid using animals in the first stage of certain research, what we can do is avoiding cruelty on animals, avoiding the situations where the animals have to suffer a lot of pain. So the ethics in animal experimentation particularly deals with avoiding animal cruelty and preventing undue suffering among animals. That's why any studies, even if the humans are not involved, any studies that involve animal participants must undergo an ethical review by an ethics committee, specifically skilled in reviewing animal-related protocols. So some of you might go on for animal studies, so it will be very important to know about what research aspects and issues involved with animal experimentation. So there are what are called as 5 freedoms in any ethical aspects related to animal experiments. These 5 freedoms are freedom from hunger and thirst. So when you get any animal for your research, you should make sure that till its end, if your research involves its death, as long as it lives, it should be fed and watered appropriately. So its own, the foods that it eats, and it should be free from hunger and thirst. There should be freedom from pain, injury, or disease. You should make sure that apart from what you are planning as part of your research, there shouldn't be any situation which causes pain or injury or some kind of illness to the animal. They should be free from any kind of discomfort. They should be kept as comfort as possible, and related to the temperature of the cage they're put in, water, etc. There should be freedom from fear and distress. As you know, animals distress very easily. They're afraid of everything. You know that any animal won't have such a long and fearless sleep as humans. They should always be alert because they are afraid of predators. So you should create such an environment in an animal experimentation that their fear is minimized as much as possible. There shouldn't be any sudden movements or sounds, etc. And there should be freedom to express their normal behaviors. If it is a bird, there should be room to fly around a bit. Mice should have their own equipments that keep them busy, or there should be some companions. Each animal has its own behavior, and there should be some efforts to create that environment for the animal to make it an ethical animal experimentation protocol. So that's about animal experiments. So a little bit about ethics review committee. So I told you all these things about ethics. There is much more. I mean, these are the basic things. But who is responsible to make
Ma'am, has it hung up?
Hello? I think ma'am is disconnected.
Yes, probably she's having a network problem.
Should I call her and check?
Yes, ma'am, please call her and at least let her know. She may not even realize that she's disconnected.
Girls, use this time to think about questions that you may have related to ethics in research. Also think of how ethics can apply in your own researches. If you have questions, you can put them up later on.
Hello? Can you hear me now?
Yes, ma'am.
So when did I, When did I got disconnected? Just now?
Ma'am, I think you were on the slide where who is responsible for ethics, the internal and external members.
Okay, okay. Oh, good. So, okay. So it's not very long though. So just now probably. Okay, can you see now?
Yes, ma'am, it's visible.
Okay. So can you hear now?
Yes, it's very clear.
Okay, so as I said, they should have both internal and external members, and chairman should be from outside the institution. They shouldn't be in any way be coerced or induced by the institution to approve the study. So that's why the head of the ethics review committee should always be from outside the institute where the research is being conducted. And the members should have a mixture of both the scientists and non-scientists. Scientists may be clinicians or basic scientists. If it is a medical research, then there should be a clinician. It should have a legal expert where to review the legal implications of the study. There should be a social scientist to see how, what impact it might have this on the society at large. A common person, a lay person, to review it in the angle of a common man. How does it affect a simple, a population, general population? And usually a theologian, a religious person, to look at it in a sensitive issues related to religion and vulnerable populations. So every scientific, ethics review committee should have a mixture of these. So hope that's clear now. So hope I'm still online. Sorry about that. So just to give an example of one of the ethics reviews committees. So this is an ethics approval letter. This is an ethics approval letter that I received for one of my recent studies. So the chairman or the member secretary of the ethics review committee should give in detail how the review was done. It should say when the review committee met, whether in person or online, whether they, after reviewing, whether advised any revisal of the proposal to the researcher, whether the researcher submitted information in consent form and in what languages, and whether the ethics committee finally agrees to approve the study. So it should say that, in the course of the study, if the researcher decides to do any change to the protocol of the study, they should actually submit a report to the committee and ask their permission. It wouldn't be usually a detailed ethics review, just a letter to the chairman saying that we want to change it in this changed circumstances. Can you please give your approval? So the ethics committee's approval letter mandates that any change in the protocol in future should be made known to the ethics committee, as well as progress of the study from time to time, and if there is any adverse effects occurring in the study. In some of the severe studies like intervention studies, where you actually do a procedure or give a drug, test a drug on participants, there is also what is called as a data safety monitoring committee, which also reviews any adverse effects happening on the participants from time to time. So that is another level of ethical management of a research. Again, this is an example of the ethics review committee of the institute, Holsworth Memorial Hospital, where I work, and I'm also an ethics committee member. So the ethics review committee should have about 8 to 12 members. So as you can see, only 2 of the committee are from inside the institute and 6 of them are from outside. Of course, it has more members. I'm one of the members. Since it is my own study, I was not part of the review committee. Similarly, my colleague, Dr. Kumaran, who is a member, but since he is also a co-investigator, he can't be a member. But a quorum should have at least 8 members presenting to review an ethics proposal. So as you can see, there are scientists, clinicians, there is a lawyer, there is a social activist, and a lay person. So constituting the ethics review committee. So as I said, so the ethics approval involves a balanced, fair, and independent ethics review committee, a transparent, clear, and detailed ethics aspects considered in the research protocol, and a transparent, honest, and skilled researcher applying for the ethics review. The researcher who has the interest of the participant utmost on his mind, more than succeeding in his research, because that's what is important. It is not succeeding in your research, but it is making sure that you conduct your research in a conducive, respectable, and respectful manner to your participant. So finally, to conclude, anyone engaged in a research, any formal research, is expected to be familiar with the ethics of data collection and use. So I mentioned a few basic principles in this presentation, mainly involving taking care of the dignity and health of the participants and their confidentiality, and personal records being kept confidential, and being transparent about your methods, or an informed consent are some of the most important aspects involved in ethical consideration. And please be aware that issues with ethics in research may affect the credibility of the research itself. So it is important, it should be the foremost consideration of the researcher, that ethics of the research are met with to the appropriate degree, and on no account a researcher will harm the ethics for the sake of having a good data. That's not important. The most important thing is safeguarding the interests of your own participants. Thank you. I hope that's within time.
Thank you, ma'am.
Yeah.
Yes, ma'am. Yeah.
As I said, if you have any questions related to that, you can always come back to me. I'm happy to answer.
Yes, ma'am. Ma'am, we can have few questions if girls.
Yeah. If anybody wants to ask question, that's fine.
Girls, you can ask questions, or you can put it in the chat box.
Yeah, I mean, if you send the questions, I can actually compile and
Yeah.
make a common document. I mean, it's ethics is something I don't know. I mean, they're all students, so it's still a new thing for them.
Yes,
if they want to consider it for a
Yes.
while, I'm happy for you to share the presentation with everybody.
Yes, ma'am.
So,
Ma'am, we have received your presentation on mail.
yeah.
And ma'am, especially for these like undergraduate students, then they are actually doing the review of literature many a times in their one of the course that they have in the semester 5, and some of them are also conducting the survey or like different kinds of actual research, basically having a small sample size and collecting data and things like that. So how will you address them as far as how to follow the ethics while doing the review? In short, in a very short.
See, if you are just doing a literature review, it is you don't have to go for an ethics review, because it's already published. It has already gone through their respective ethics. So if you are not using any personal data, if it is just a summary data from the existing literature, ethics review may not be necessary. However, if you are doing a survey where you are actually collecting new data, but if it is not, it does not involve any serious adverse, effects, or, it does not involve any major assessments, you are just phoning them and asking, some their preference, etc. You can ask for an expedited review. if it is as part of a research, if it is a survey, it is a survey. If it is a research, even if it is a survey, you have to go for ethics review approval, but you can go for an expedited review where there need not be all this quorum, etc. The chairman can or member secretary can take decision and approve the study. But if you are taking any data and you call it a research, then you have to go for ethics approval. But literature review should be fine. Hope that answers your question.
Yes, yes. Thank you. Thank you very much, ma'am.
If you have any questions related to your students' research, you can send me a mail also.
Yes, ma'am. Yes.
Pragna ma'am, may I add one thing here?
Yes, 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 Janvi.
Girls, while you are reviewing your literature, be sure your ethics are in terms of even how you mention someone else's research. So if you are misrepresenting,
Yeah, I meant that only, Janvi.
that
Yes.
will be unethical.
Yeah, yeah,
If you are plagiarizing, it will be unethical. If you are giving definitions but no source, that is unethical. So although it will not go under that ethical committee review, but you have to be extremely sure of these things.
Exactly.
Yeah, definitely. See,
Yes.
literature.
Yeah, ma'am, actually I meant that
Yeah.
only. Yeah.
Yeah.
Because these girls are doing the literature review and then they are presenting, ma'am.
Okay.
So, and some of them will go for maybe compilation of all these studies in terms of a review paper and then may publish it. Some of them are actually doing that. Some of our undergraduate students every year. So I meant in that aspect, ma'am, like how to give the acknowledgement to the research which is already reviewed.
Yeah, I mean that
already
probably
done,
that doesn't come under most mainly it's not ethical. It doesn't come under ethical ambit. It's more a good research conduct. It is the conduct of a researcher. So plagiarism and other things. They are more conduct of the research rather than ethics. Ethics involves when there are actual participants involved. But anyway, it's a good research practice, and they should always acknowledge where they got the information from. Of course, you are right. Yeah. Anything else?
Ma'am, about the ethical committee, the main thing that you have shown on biomedical ethics research,
Yeah.
in research in biomedical field. So, but that remains the composition remains the same for any from different fields to field.
Sorry, it broke. Yeah. Can you repeat? I can't hear you.
At the end.
Hello.
Yeah. So it changes or it remains the same.
The ethical committee.
Are you able to hear?
Yeah. Now, I can hear.
Yeah, committee members. Yeah. The composition of the committee, it changes. Ethical committee, yes, ma'am.
Yeah. See, I mean that the important thing to consider is there should be a mixture of people who know about law, people who are social scientists and layperson, and the research. This expert. There should be an expert member. It may be a doctor if it is a medical research. Basic scientist if it is related to something. It is something biomedical engineering, someone related to that. So there should be an expert to assess the proficiency of the researcher as well as the quality of the research involved in that particular field. So other composition should be a mixture of all these layperson, social scientists, etc. It is essential.
Your students.
Pradnya ma'am, are you trying to ask something?
Yes, sir, Janvi, if you want to ask anything from students' point of view. Am I audible? Hello?
Yeah.
Am I audible? Yeah. No, I said, Janvi, if you want to ask anything to ma'am from students' point of view.
Ma'am, one question. As
Yeah.
being on the ethical review committee, what are the most common ethical errors which you have come across in students' proposals?
So the common error, see, I mostly, since I am a doctor and I'm in a medical institute, I usually get all this, clinical proposals. The most common error is, they usually don't see. One of the things is, since they are doctors, they take it for granted that, they come to them as patients, so it's okay for them to just ask them to undergo certain assessments. So it is not acceptable. If you want to do it as a research, it is your responsibility to provide for, any expenses involved in the research. And the consent part is another most commonly occurring error in these researchers. They just, they forget the barrier between a clinician and a researcher, and they just take it for granted that anyone who come to the hospital will just go, can become a participant. So consent is the most commonly occurring error.
And I think for students also, this is a very important point to remember. You may think that someone is your friend or you know them, so you could just request them for research. But that
No, yeah, that is again, see, the same issue happens with someone like our institute, research institute, where I have been seeing some participants for 20 years. Sometimes it's very difficult to get informed consent because they know us well. So they just may say, yes, okay, I will answer the questions. So you should make sure that, you give all the information and tell them that if they are, they are free to leave if they don't want to. They don't have to.
thank you, ma'am.
Thank you. Thanks very much.
Thank you very much.
Thank you, ma'am.
Thank you, everybody. Thanks
One
for this.
minute. Huda, will you conclude? I mean, vote of thanks? Yeah, 1 minute.
So, ma'am, on behalf of the STRIDE team and the students of Dr. BMN College, we'd like to thank you for your time and your consideration for giving us this very informative lecture on ethics in research. I hope the students have been able to uh, understand exactly what ethics means when it comes to research, and they will be able to apply this to their research proposals and also their initial journey in.
Yeah. Thank you. Thank you for this opportunity. And I know that, this may not be directly applicable to the students at this stage of their career, but, it will be really helpful to go with this mindset into their futures. And as I said, if they have any specific questions related to their current situation and research, I'm happy to answer them by mail. So
Sure.
thanks again. Thanks everybody. Thank you.
Thank you.
Yeah, so really enjoyed
Thank
the
you very
session.
much. I'm looking forward for
Okay.
your association
Bye.
in future. Bye. Bye.